Melanoma is a cancer that originates in the melanocyte. So that's where the name comes from. And we have melanocytes in the skin, but also in the eye and in the mucosa of the intestine. When it comes to hereditary melanoma, and the genes we are talking about, CDKN2A and CDK4, they are mainly associated with a high risk of cutaneous melanoma. We also know that pancreatic cancer is part of the cancer spectrum. For other types of cancers, there is some evidence that variants in CDKN2A is associated with an increased risk of other tobacco associated cancers like lung cancers and also ear, nose and throat squamous cell carcinomas. There are also other types of cancer that has sporadically been reported, and among them is leukemia and breast cancer, but the evidence is not there yet. We know that fair skin is a risk factor, and we see more melanoma in countries where people in general have fair skin, blue eyes, and a lot of sun, like Australia. But also in the Nordic countries, we have a high incidence of melanoma. Not so much in Southern Europe, like Portugal and Spain and Italy. When it comes to hereditary melanoma, of course, if you have a germline pathogenic variant that gives an increased risk of melanoma, you will always also be at risk if you have the dark skin. But even when you have a pathogenic variant like that, the risk will be higher if you have the fair skin. And we know, of course, for melanoma that sun plays a role. So that is something that we encourage individuals with these variants to be very careful with the sun. And that is to take care of your skin, avoid the sun when it's strongest, use sun protection, and you should obviously avoid smoking. Because we know that the other kinds of cancer, like pancreatic cancer, but also the mentioned lung cancer, we know that that occurs mainly in people with these variants who also were smokers. So there are some things you can look for when to suspect hereditary melanoma. And that, of course, is if you have multiple cases of melanoma in one family. Could also be multiple cases of melanoma in one patient. But when it comes to like referral criteria or criteria for germline genetic testing, you also have to take into account the population incidence of melanoma. So that means that in high incidence countries, we usually talk about a rule of 3, like in Scandinavia, that you should have at least 3 cases of melanoma in at least 2 different individuals, or it could be the combination of melanoma and pancreatic cancer cases. And then, if the criteria is fulfilled, then you could go for genetic testing. In most cases, nowadays, one would do a gene panel with the melanoma genes, including CDKN2A and CDK4. They are referred to a surveillance program with regular dermatological exams with an experienced dermatologist who take photos of the skin and look at the whole skin. With that, the potential melanomas can be detected at a very early stage and can be removed with no need for further treatment.